VCOM-Auburn, Beyond the White Coat, where we explore the multifaceted world of healthcare and medical education. Every episode, we will bring you insight conversations with experts, VCOM-Auburn students, and healthcare professionals, revealing their unique experiences and perspectives. Get ready to delve into groundbreaking research, innovative treatments, and personal stories that will shape the future of medicine. Let's go beyond the white coat to uncover the human side of healthcare. Hello, everyone, and welcome back to VCOM-Auburn, Beyond the White Coat. I'm your host, Brittany Lilla, and today we have a special guest. Do you like to introduce yourself, Mayra?
Yes. Hi, my name is Dr. Mayra Rodriguez, and I'm the Discipline Chair for Preventive Medicine and Public Health here at our VCOM-Auburn campus.
Well, perfect. Thank you, Mayra, again for joining us today.
Yes, absolutely. Thank you so much for having me.
Yeah, of course. So, Mayra, let's start from the beginning. Can you walk us through your journey to becoming the discipline chair in these areas here at VCOM-Auburn, and what inspired you to pursue this career path?
Yeah. So, I'm from Texas, and I've had, from the beginning, I had a couple of choices to make whether or not to pursue academia or government work like the CDC. So I was eyeing CDC work at the very, very beginning. And when I came and I learned about, VCOM and what they did, I was so pleasantly surprised to learn about how they had this mission, right? That they outlined and delineated this aspect that for me, it rang very, very much true to addressing all the health disparities from the public health perspective. And so for me, I found that to be so unique for an osteopathic school to tackle those problems because, one of the things that I learned in graduate school was, in my training, was people, faculty and saying, well, clinicians don't, it was this constant trying to tackle public health approach. And we, at least what professionals were telling me was that we were kind of coming into heads with clinicians. And so in my mind, in my training, I thought, well, we have to fix this. We have to make sure our clinicians get it, right? Because it's a different perspective. It's having our clinicians look at our patient, right? Patient after patient from that scale, where public health professionals look at the macro perspective. And so I thought it was such a unique and fantastic experience to put in, a couple greens in and have the opportunity to educate our future clinicians if what I believe is the greatest field, right? Public health, understanding the systemic and ongoing problems that we face in medicine. And so that's why I was so excited. I never thought I'd, come to live in Alabama, but I was one of the founding faculty here on our VCOM campus in Auburn, and I can't believe I'm starting my 10th year now. So
that's awesome.
I've liked it a little bit, right? So I've stayed here enough. Yeah. So anyway, so that's that. And so in terms of your second question, you said pursuing a career in public health altogether. I think for me, public health wasn't necessarily, a type of field that, growing up in kindergarten or first grade, I thought, oh, I want to be a public health professional. I think
Right.
I just in my mind, I was like, medicine, I want to be a doctor, just the classic aspect. But when I learned about the field of public health, it was as a result of me being a research assistant in a large clinical trial. And I was essentially the research assistant, and I was going out to clinics, recruiting patients. And I got the opportunity to see not just and learn about the different systems because I was going to different clinics trying to recruit patients. And so I had the opportunity to compare and contrast different clinic functions, different systems, as well as I was also interviewing the participants that were enrolled. And so I was able to learn a lot more, in a very concise environment about patients, stressors, frustrations, and their health problems. And so I learned and I discovered that there were common things, right, that patients had problems with. And I learned that the disparities that exist between clinics and all of that. And so that's how I found my passion in public health. I thought it was absolutely eye-opening. I think once I saw that, I couldn't look away. And so that's how I kind of steered my way towards public health.
It's inspiring to hear about the experience that shapes someone's career path, and it sounds like each step brought you closer to where you're meant to be.
right here, guiding our
Auburn.
future physicians as well. So thank you for that. And now let's talk about your work here at VCOM-Auburn. You teach several courses. Can you tell us about more about some of the concepts you emphasize with your students?
Yes, absolutely. So I think I like, or at least the way we like to explain what the public health component is with our medical students is essentially this giant course, and it's broken up into these sections throughout the year experience. And so I teach first and second year medical students, and we, as you can imagine, or maybe for people that are not familiar, public health is this giant umbrella, this huge umbrella that encompasses so many components. Um, and so we tackle these different components throughout their experience. First off, want have we want to have our students focus on the understanding of the numbers, understanding of the evidence. And so
Mhm.
we tackle, in terms of content, epidemiology 101. So it's understanding the why of the conditions, but understanding the numbers, right? So formulas,
Right.
definitions, what does risk mean? What does prevalence mean? And then, of course, the biostatistics, right? What does it
Mhm.
mean? What does a p-value mean? Is there clinical significance? Is there statistical significance? And so, if there's one thing that COVID taught us was the importance of having our healthcare professionals, our clinicians, being properly trained to interpret the evidence, right? And being able to not just interpret it, understand it, and then be able to relay it to their patients. So this is absolutely crucial component is having them understand the evidence, how to look at a literature, an article, and critically appraise it, weigh it for what it is, right? For the evidence, and then move forward and make proper suggestions. Because the truth is that there is no perfect research design or research study. There is no perfect, this perfect, crystal box that produces fantastic outcomes. If we had that, then our world wouldn't have so many problems.
Mhm.
But with that said, there is something to gain from any kind of research study. And so a clinician with their refined eyes and skills are able to then take that, right? Take the components
Mhm.
that are relevant and important and move on and do that. So that's what we do at the very beginning of our
Okay.
experience. And then we move on and talk about other components, whether more of the systematic issues, clinical informatics, the understanding of the systems to, everyday clinicians, right? How does it work? How does technology come into place? How does it hinder? How does it improve medicine? And then we, focused at the tail end, prevention. We understand, in the osteopathic field that it's best, right, to work with our patients and talk to our patients about prevention, but how do we best do that? And how do our systems, our larger systems, either, push that forward or hinder us from creating those prevention efforts? And so we talk about all the good things, the difficult challenges that we have ahead. But, at the end of the day, what's valuable is having our students understand, again, the bigger system, the larger system. So that way they're not shocked, right, when they go over to their
Mhm.
third year, they are better equipped to understand all of the layers that our complex healthcare system has to offer.
Definitely. I love that approach, especially you emphasize on those fundamental concepts that are so relevant, not just academically, but practically too, especially as students move into the real world healthcare settings. So, speaking of real world experiences, I know you engage a lot of your students in research. Can you tell us about the kinds of projects students work with your guidance? Maybe some memorable or impactful projects that stand out to you?
Yes, absolutely. So a big component, as I mentioned to you earlier, is having our students understand the evidence. And so one of the ways that we do this is having them applying their knowledge. So it's not just exam and, take study something and take an exam. It's really about having them apply the concepts that they've learned. And a way we do that is to have them from scratch develop an idea submitted for, IRB or an ethics approval board and have them implement that idea as a research component. And so that experience is a cumulative experience from the beginning to the end of their PrevMed course. We've only been doing this. I think we're starting our 4th year. We started this,
Okay.
I want to say a little bit after COVID or during COVID. And it was,
Mhm.
of course, as you can imagine, difficult. It's having to roll out such a massive effort with our students, but we have
Absolutely.
learned, our students have learned to connect. There's so much to say about these projects. I can go on for days and days about the impact and all the learning that has been done, all the layers that we have given. And so a project that stands out for me is one that we did last year with a couple of our students, is having our students, they really wanted to tackle health communication, right?
Okay.
Especially among younger children. And
Mhm.
so what are the messagings? What's the messaging that we're giving our children? How do we address that? How can we best improve that? And so they wanted to test this idea of, well, books, health education books. And for children at that level, how much do they take in? How much do they change their behaviors? And so, behaviors is
Right.
a whole other component that, as
Mhm.
adults, we know that can be difficult to change, but as children, hopefully, they're a little bit more responsive to that
Yeah.
flexibility. And so we had students actually write a book, draw out a book, and they had these sheets for a long time, and then they actually published a little book, the little children's book, and
That's
they
amazing.
worked with a school right in another county here in Alabama, and they read the book to the children, made assessments, and trying to make sure that what is their perception? Do they understand the concepts? Do they not? Did stuff just kind of go over their head? And how much did they change their behaviors? Are they likely to change their behaviors? So obviously you can think and see how much work and effort is put in essentially testing a concept, right?
Mhm.
And so this is all on top of the students' everyday, weekly, hectic experience in medical school, which is countless of tests and countless of material that they have to engage in, as part of the other courses. So that was one of our projects. Another project, I mean, and again, this experience for research students either worked in nonprofit organizations, or they collaborated with clinics, hospitals, schools, as I mentioned, or faith-based centers. And so the scope of their experience is really diverse. At the end of the day, the purpose for these projects is really to have our students, one, engage in, how can they develop a community-focused
Mhm.
effort, right? If there's anything that we understand from osteopathic medicine, specifically VCOM, is having our students connect um, and listen to what our community is telling us. And so this is one way in terms of collecting data, is having our students understand what the community is needing, what are the gaps, what are the problems. And so our students are trying to, mesh in and trying to address some of those needs. Another project that we had was our students working with a nonprofit clinic and working
Okay.
on a best way to, in terms of prevention, self-breast examinations. How do we communicate those efforts to an underserved population that doesn't readily, go to clinics or doesn't necessarily have access to, getting a mammogram every, few years, or et cetera. And
Right.
so, tackling those components are, they can be difficult in any rural setting. How do we get the numbers? How do we get the sample size that we need to complete that? But slowly but surely, your students work very hard to try to get the sample in, to try to get some kind of an assessment of what's the best way to communicate with our underserved population.
Wow, those sound incredible, Myra. Um, well, I know that we'll probably have the article that has the actual book on our link below after this podcast too. I just want to mention that.
Oh,
But
very cool.
that's what an amazing opportunity for the students to dive into the hands-on research and really make a difference. I can only imagine how rewarding that must have been for not only them, but for you especially, and to see them thrive.
Yeah.
So
And
Yeah.
sorry, I'll just add
No.
that I think the biggest thing is having our students, or having our community actually be so supportive of our students
Mhm.
and so excited to have them come back, following year and say, oh, yes, we would love to have them again. This project that
absolutely.
they did last year, it really warms our heart. And to me, it just tells me that this is exactly what we need, right? We're
Mhm.
extending those tentacles, right, in terms of, having that collaboration with our community, and we are only increasing our network, our relationships are getting stronger in those communities. And I think that's probably the most valuable thing, I think.
Oh yeah, it's truly impactful to see, and it's just amazing to see how it progresses throughout. So on the topic of research still, I would love to hear more about your own projects. Are there any current studies you're leading, or perhaps recent ones that reflect your interest in public health?
Yes. So we just finished a project with Dr. Sarah Watts. It's a Big Corey funded project. And the purpose of the project was to engage. It's a community engagement project. It's to engage Hispanic women in research. And so it seems like this complex approach to things. But really, if I explain that a lot of the research that's published and done really has the influence or results from a small number of minorities. So in reality, we don't have a lot of representation. So when we look at health outcomes, we are struggling to have, again, people from underserved areas, people of different ethnic or racial backgrounds represented in research projects. And so there's an obvious disconnect there. And so if we want to, as researchers, improve the health of these underserved populations, we need better ways to engage them in research, right? So it's like this cycle to trying to, well, how can we best improve? We can't just say, well, this is what you need. We have to figure a best way to connect. And so it's essentially a community capacity project is trying to elevate the Hispanic population, not just community members, but healthcare professionals that work with a Hispanic community, getting them all in a room and talking about the healthcare issues that impact the community, trying to find ways to improve them. And so slowly but surely, the project went from, well, yeah, these are the problems that affect me. But really what we're doing is, again, community capacities, having our community members educated and elevated to think outside of themselves. So not just what affects me, but what is affecting my community as a whole. And what are things that I can do, or how can I best serve as a conduit, as a venue to improve the health outcomes of my community. So having them see themselves as leaders, as change makers, and to further, improve the health is absolutely important. So it's a different type of research project, a different type of approach. But really what it is if you think about, Alabama is a largely rural environment, and we have to think differently when we are trying to solve the problems of rural environments. So we can't have the same formula that we use in urban cities, because in urban cities, we know we can have populations everywhere and they're easy to find. We can go anywhere, we can find them. But in more rural areas, it's harder. And so we have to think outside the box. And one of the things that we're learning is, there's limited resources, and of course it's everywhere, right? Limited resources. But when we're trying to connect with these underserved populations, we have to find more feet on the ground, right? We have to think about other ways to connect, so we can elevate a community and train them and educate them. They can better serve in terms of prevention, in the short run, and improving those health outcomes. In the long run, this community is better equipped essentially to guide us in training for better research questions, right? What are the things that we should actually be looking for? More focused, more tailored research questions to find better, hopefully better answers.
Absolutely. Well, that's really interesting. And it's clear you're addressing some crucial public health issues. You're truly highlighting how preventive medicine can really create a ripple effect in the communities. So what do you find most rewarding about working with VCOM-Auburn students in public health?
What I find most rewarding, oh my goodness, just last week I ran into a student in the hallway, and just to hear them say, I did this and I loved it, and I'm so excited and I'm so glad you had us go there, or I'm so glad that you taught us this. And so sometimes, like children, I have children, you make them do things and they like kick and scream and they're like, oh, why? And so sometimes it feels that way. But at the end of the circle, right, at the end of the line, when they're either presenting papers and they're going out on conference and they're connecting with other people, other professionals and they, produce the results of their work, they feel validated and they feel heard. When there's another researcher out there, where there's somebody else that say, oh my gosh, this is so important, or, have you thought about this? Getting other kinds of impact and support is absolutely valuable. And so, students come back from conferences and whatnot and they'll say, thank you so much. This was a great experience. I loved it. This is great. And so you see the full circle moment. And hopefully, I think for me, it's important that we have our students not just, trained to be empathetic and able to have that listening ear to their patients, but also have the proper tools to critically evaluate the patient's issues, right? Critically evaluate the data and make proper decisions. And then last but not least, in terms of this bigger social issues, is having them be social advocates for their patient population, right? And hopefully push forward for better health policy.
Well, that's beautiful, Mayra. Hearing you talk about those meaningful interactions remind us all why education and mentorships are so powerful. So looking to the future, are there any specific goals you're excited about? Perhaps new research area or incentives you'd like to explore?
Yes, I think, gosh, the field of healthcare is an ever-evolving, complex animal. And so I think now more than ever, when we talk about health communication, it's absolutely crucial. It's rising to the top of my priority list when I think about future topics to have our students work through and address: health communication, health information, health misinformation. And so being able, as researchers, we have to be able to see a problem and be able to tackle it. We also have to try to get ahead of the game, right? And so we need to do a better job in tackling this with increased AI, which is fantastic. It has increased our ability to be more effective in a lot of ways, but also it can be a source for misinformation, right? For our patients, our general health population. And so I think that's probably one of the biggest components that I see that is in need of attention. I think we need to get a lot more serious as a public health, as a field, to try to tackle these components. And sometimes we think about, well, maybe that is going to be something that probably should be, addressed for more urban areas. I don't know, maybe you think of it and say, well, that's not really a problem in our area. But on the contrary, my argument would be, because we're more rural and underserved, information is often fragmented, and we need to find better ways to connect to that. Because even though you have, the best technology, right, in more urban areas, you would say, the more rural areas are still getting the misinformation, whether it be, again, in different components, right, packaged differently. Maybe directly through social media, maybe not, but the people that they trust. And so is working through that and trying to, again, provide the best information, the most accurate information to have our patients live healthier lives. And that's the goal, I think.
Yeah. Well, those sound like wonderful goals, Mayra. I'm excited to see where you're heading and how you plan on contributing to the field. And of course, to VCOM. Before we wrap up, I would love to hear your advice for students interested in public health and the other fields. What would you say to those considering a career in this field?
I think for students, they are the new wave of frontline workers that are not only treating their patients, but they are now equipped, right, with the tools that they need to properly tackle, again, as I mentioned, the complex healthcare system. The idea that our physicians of today are serving their patient population is absolutely crucial. But I think what we're seeing now is that our physicians not only wear one hat, we know that they are, bent and flexible and moving around to suit and fill other gaps. that are needed in the healthcare system. Again, as healthcare administrators, as advocates to produce better healthcare policy. And so if that's one thing that our future physicians, as they continue through their training, they understand they will be better equipped to be able to step into those shoes when they're called on to do so.
Well, thank you, Mayra. This is such valuable advice. I'm sure our listeners will find it helpful as they consider their own paths in healthcare. Mayra, I'm sure our listeners have learned so much, and not only on what you do, but also the vital role of public health in our society. So thank you for joining on VCOM-Auburn Beyond the White Coat. And thank you to all our listeners. If you enjoyed today's episode, be sure to subscribe to VCOM-Auburn Beyond the White Coat on your favorite podcast platform. That way, you won't miss our upcoming conversations with incredible people who make VCOM what it is today. Feel free to share, leave a review, and let us know what you'd like to hear next. Until then, I'm your host, Brittany Lilla. I'm signing off. Take care.
Thank you for joining us on this episode of VCOM-Auburn Beyond the White Coat. We hope you found the insights and stories that we shared today both informative and inspiring. If you enjoyed this episode, please subscribe, rate, and leave a review. Don't forget to follow us on Facebook, YouTube, and our website for more updates and resources. Until next time, stay curious and keep exploring the fascinating world of healthcare.